The Sunday Mirror has a grim front page there saying that this week we will hit 100,000 official fatalities from COVID-19. We're one of the worst in the world. The Observer has a story about a mass outbreak of COVID at DVLA in Wales. And finally, the Sunday Times is focusing. We have the First Minister of Scotland, Nicola Sturgeon, on the show, and on cue they have a big polling-based story, Our Disunited Kingdom, looking at the sheer numbers of people in Scotland, Wales and indeed Northern Ireland who are thinking about leaving the UK.
Nicola Sturgeon's handling of the pandemic is perceived to be very strong, whereas Boris Johnson's is perceived to be very weak.
The Shadow Foreign Secretary, Lisa Nandy, joins me from Salford. Lisa Nandy, welcome. Thanks for coming in. Can I ask you, first of all, do you think that everybody who's had a first dose of the Pfizer vaccine should, as the BMA says, get a second dose within 6 weeks?
Well, I just have to say to you that we've always said in the middle of a pandemic that this has got to be guided by evidence. There is a good reason why the Chief Medical Officer has decided that this is the right approach, because we're in a race against time to get the vaccine out across the country, and based on the evidence that he has, he believes that getting a 12-week gap is the right gap. Now, if there's new evidence, and it appears there is, to suggest that 6 weeks might be better, then what we'll be asking for when we next meet SAGE, and what we'll be pushing the government on in the House of Commons this week, is can you make sure that you are level with the public about that, share that information with us, and that people can have confidence in the decisions that are being made.
Let's talk about the vaccine rollout then. Do you think we should close our borders to incoming flights from countries which don't have high vaccine coverage?
Well, I think the problem that's emerged is that although we've seen new strains of the virus identified in the UK, South Africa, Brazil and others, these are largely the countries where we have the capacity to actually map and track mutations of the virus. Scientists tell us that there are a number of countries where these strains are emerging that just simply do not have the capacity to map what is happening. So it's not just countries that have identified the strains of the virus that we ought to be careful about. Actually, what we're likely to be seeing, even if we haven't identified it, is strains emerging all over the world. So there is no question that we need to take border security far more seriously. We've been pushing the government to take tougher measures at the border since last spring. On Monday, we've got this delayed announcement, yet again delayed. Right. We would fully expect the government to bring in tougher quarantine measures. We would expect them to roll out a proper testing strategy, and we would expect them as well to start checking up on the people who are quarantining. Only 3 out of every 100 people who are asked to quarantine when they arrive into the UK actually faces any checks at all. That's just simply not sufficient.
Health Secretary Matt Hancock. Matt Hancock.
Good morning.
Good morning and welcome. Now, we've got the UK now with the highest number of daily COVID deaths in the world, and in terms of proportion of the population, one of the highest in the world. After 3 weeks of lockdown, are you in control of the virus?
Well, good morning, Andrew. The good news is that there are early signs that certainly the rise in number of cases has been halted, and in many parts of the country that cases are starting to come down.
I've been talking to your opposite number in Israel, Mr. Edelstein, and he says that before restrictions can properly be lifted, they have to vaccinate 80% of their population. Is that the kind of figure that you're looking at here?
Well, it's far, far too early to say. And the reason it's too early to say is because we know with a high degree of confidence that the vaccine protects people from serious disease and, of course, from dying, which is obviously the whole purpose of it. But we don't yet know the impact on how much the vaccine impacts on how much you transmit the virus. So that's why it's so important that people continue to stay at home after they've had the vaccine.
Ask you about GPs, because quite a few GP practices are saying they are not getting enough supplies of the vaccine because it's being diverted into the great big new vaccination centres. Are you ensuring that GPs, who are after all really on the front line of this, are getting enough vaccine everywhere?
Well, of course, supply is the rate limiting factor. I don't know how many times I've told you that, Andrew, and said it in other places too. So supply is the rate limiting factor. The GPs are doing brilliantly. Frankly, I'd rather have a problem of all the teams on the front line in the NHS saying we can do more, we want more vaccine, because that demonstrates that as soon as we can get it into the country or get it manufactured here, we can then get it out through the NHS.
Death rate in Scotland is now below England, but the vaccine rollout has been slower. Why? I'm joined now from Glasgow by the First Minister of Scotland and SNP leader Nicola Sturgeon. Nicola Sturgeon, there will be lots of people at home in Scotland in their 80s watching this interview, still waiting for their vaccine appointments and reading that down south in England more than 50% of 80-year-olds have been vaccinated already. What would you say to them?
We took a deliberate decision in line with JCVI advice to focus initially on vaccinating older residents in care homes, because that is going to have the most immediate and biggest impact on reducing the death toll. You've quizzed me rightly the last couple of times I've been on the programme about the death toll in our care homes. So I heard Matt Hancock on the programme earlier say that about 3/4 of care home residents in England have been vaccinated. In Scotland, that figure right now is 95% of care home residents. It takes longer, it's more resource intensive to do care homes, but it's the right decision in my view. Of course, we're now rapidly catching up on the over 80s in the community. We've done around 40% of those, and that's gathering pace every single day. We're well on track to meet the target we've set to complete all over 80s by the beginning of February. And of course, as of tomorrow, those in the over 70 category will start to get their appointments for vaccination as well. So we're all working to the same targets. I think we will see overall that we all are making good progress through this vaccination programme. But I think it is right, and I am very assured that it is right for us to have focused on protecting the most vulnerable to serious illness and death from this virus as early as possible in the programme.
Well, let's talk about the vaccine supply. So far as we can tell, Scotland has been allocated 700,000 doses for the time being, and 380,000 have been given to people. So what's happened to the rest of it? Genuine question. Where are they? What's happened to them?
They're flowing from the allocation, and there's a difference between allocation and receipt, into Scotland, to our health boards and into our GPs. So we have already used about 400,000 doses, and the rest will be going into people's arms over the days to come. Now, of course, the UK government have asked us not to talk in detail about the supply. We had published lots of figures about supply that they asked us to remove from publication. But we are, just like the UK is, vaccinating as quickly as possible. We have a target in common with the other UK nations of having vaccinated by mid-February everybody in the top 4 clinical priority groups that the JCVI has set, and we are on track to do that. Head of Scotland's GPs on Twitter just a day or so ago saying that firstly that Scotland's approach is the right one in his view, and that great progress has been made on supply and on vaccinators over previous days.
Dr. Andrew Buist. He also says the supply of the vaccine so far has been quite patchy, and there is a worry, I mean, we've been talking to GPs, there's a worry among Scottish GPs that there are too many levels of management compared with England, and it's taking too long to actually get to the GPs on the front line.
Well, I'd make a couple of points about that. The quote I've just used from Andrew Buist is actually, I think, more up to date than the quote you have just used. So I've also just seen you put to Matt Hancock many of the same concerns about patchy supply for GPs that have been raised in England as in Scotland. That is, I think, smoothing out and starting to be resolved. We have had the rate limitation of the number of packs coming into Scotland, which has limited supply to GPs. On this question of whether there is a more bureaucratic system in Scotland, I don't think that's the case, although we will always look to see what we can do to simplify that. Our health boards order the supplies and then allocate onto GPs. In England, that's done through clinical commissioning groups. The average population size of those is about 400,000, similar to the average population size of our health board. So I don't think that is the case, but we are not complacent about any aspect of this. We are taking very clear decisions about protecting those who are most vulnerable most quickly. And I come back to the point I started on, 95%, it's probably more than that now, of older care home residents in Scotland have been, no, don't cut me off here, have been vaccinated compared to 3/4 in England. So we're further ahead on care homes. The top group in the JCVI priority list.
You have said that
already. As a result of the resources on that, we are slightly further behind on the over 80s in the community, but rapidly catching up on that and on track, as I hope all nations in the UK are, to meet the targets we've set.